Gerard, thanks for answering a couple of questions related to this symposium in September. I wanted to start just by acknowledging that people have a lot of fear and concern around pornography, especially in mental health. And it feels like a lot of that fear and concern has to do with violence, exploitation of women and children. And given your expertise and your clinical background, I wanted to ask you to talk a little bit about how pornography shows up in your clinical practice.
Sure. It shows up primarily with males of all ages. I work with little fellas, little boys, teenagers, and adults, and they all come in for different reasons. I work with both victims and perpetrators of child sexual abuse. So um, uh, certainly pornography has a negative angle in the way it comes to me.
Mm-hmm.
It's not to say that I have a particularly puritanical view about the whole thing, but when it comes to who comes for help, it's often part of the problem. It's with children. They've been they've been exposed to it. Most of them have eagerly sought it out because it's being very sexual beings. Children are very curious to learn about all sorts of things that adults hide from them. And of course, now with the internet, they've got easy access. And if they can't find it, their friends will. And they'll all have all sorts of fun and games with it. The problem is with the younger kids, if they're overstimulated, and they don't, of course, have the permission to talk to adults about it. There's a whole lot of things that they see that they have to kind of come to terms with that can be very problematic. Like the interpretations they give to even rather ordinary heterosexual scenes can be taken by them as somewhat hurtful. So a woman moaning in ecstasy, we would recognise in a microsecond, troubles some children because they think that the woman's moaning in pain. So children don't have that relationship with parents or adults who can help them see what's actually going on and make sense of what to them is foreign experience. Then there's the issue of overexposure, where the children become very sexualized, and it goes beyond curiosity to wanting to experiment with it themselves. Now, without the capacity to think ahead, to recognize what the consequences might be, they might find the wrong partner to do that with. Of course, it's perfectly normal and healthy for kids to find children in their same age group to discover all things joyful about sexuality and the different aspects of that. And that's what, in a way, that's what we want. We want kids to know by the time they're 18 what sex is all about, that it's healthy, that they have a healthy sense of themselves as sexual people. They also know what the boundaries are. But the children that come to me have found the wrong partners. They've found a little sister or a little brother or the kid next door, and the age difference makes it a harmful experience for the younger child. 9 times out of 10 because of the secrecy and sometimes the coercion that goes with that. Mm-hmm. So pornography is kind of part of the child's experience that leads somewhere. And I guess that same theme goes through for adults too, where the people that come to me may well have had fairly ordinary histories of looking at pornography and enjoying it, as is commonly the case, across the world. Mm-hmm. But for them, they seek more and more unusual images to get the hit that they once had. Some people talk about this as a slippery slope. Some people talk about it as the onset of addiction. I have problems, certainly with the latter. The addiction model applied to this area is hugely problematic. But that said, clearly there is a risk for some people who will end up finding themselves in situations where people actually aren't performers. They aren't models. There's no justice in the experience for them. They simply are being exploited or sexually assaulted. And that could be women who are being filmed against their will, but certainly children who are now any sex offender with a smartphone can produce pornography and feed the internet with all sorts of images.
Yeah. Gerard, your background is in forensic psychology, and also you're a psychoanalyst. I'm wondering if you can talk a little bit about maybe how psychoanalysis specifically helps you think about complex problems related to pornography and sexuality. How does it influence your work with clients?
I think where psychoanalysis is strong is that it takes, when it's respectful of the research that's done by various disciplines, including psychology, sociology, anthropology, that we would give due respect to the themes that are coming through from researchers and from theorists. But we tend to look at what's not obvious or what's emerging in the data and ask why and how this is developing. And, my therapeutic and treatment and theoretical approach is psychoanalytic complexity theory. So that theory in particular takes from all of the systems of thought that are out there contradictory attitudes, say to some phenomena like pornography use, its various meanings, but also how it continues to unfold and take shape in society, but also within the person. So psychoanalysis obviously has had its beginnings in trying to understand what's the role of the unconscious processes in all human action, in how we relate to each other, how we experience ourselves. But I think a more contemporary view is much more mindful of the cultural milieu in which an individual grows. And so things that are going on in society are bound to impact. And it's an error on the part of more traditional analysts who just want to look at what's going on inside the person's mind. We have to be thinking about each action. For example, a child getting super charged up by pornography as being an emergent process of thousands of factors that come together. And so this is a kind of human rights perspective as well, because it's very easy to point the finger and say that child is a criminal or that child is somehow deficient or bad, when in fact they're responding to a whole set of factors that predispose them to go down a certain path. And being non-linear dynamic systems in its underpinnings, children's behaviour, and as with adults, changes all the time. So we would be keen to follow how an individual experiences something, but then how that changes over time. But ultimately, what the meaning is for that child, helping them in the therapeutic setting, not only to understand, but to be in a better position to make choices about where they want to take it next.
Gerard, thank you so much for your time. And I'm looking so forward to your contributions in September at this symposium. Thank you.
Very welcome. I look forward to it. It's going to be a great symposium.